I mean, I'm sitting here with two guys that are college educated.
All right, voice levels up.
Voice levels up. I mean, listen. I mean, I don't know the Red Sox, but I feel like, so if I slap you, you're going to slap him? Is that how it's going to work? Good right down the roll?
Then he's going to try to hit me, and I'll duck, and he'll hit you.
I've been hit before,
I smack hard.
Yeah.
That's right.
I tell you, this
That's
is
not
exciting,
good.
John. I mean,
Yes, it is.
There was a little buzz in the meeting, the pre-meeting. We had the little meal, the coffee, and the Danish set up. The production people went above and beyond. The director, we brought somebody.
Thank you, production manager,
That's
for the coffee and the.
Unlike prior guests, though, I mean, our guest Jose. Jose, welcome aboard. John, please applaud.
Thank you.
Okay, thank you.
Thank you for having me. Thank you for having me, guys.
He drove his own car here.
We
I'm very
have
impressed.
our own Supreme Court Justice. Jose's last name is.
Sotomayor.
Oh, beautiful. I need as many hookups and connections as I can get. This is always good to know.
There you go.
So, John, let's do a countdown.
Do it, brother.
We'll start the podcast.
Okay.
5, 4, 3, 2, 1.
Welcome back, friends. Welcome back to another episode of The Jersey Alchemist, and I'm your host, Dr. John Gerard Gallucci.
And I'm Philip D'Angelo.
Say it, brother.
And I'm Jose Sotomayor.
Wow. VIP. More applause.
Thank you. Thank you for having me, guys. Thank you for having me.
It's a pleasure.
Thank you.
Just keep close to that mic.
I will.
Right, without shrinking away. Yep.
Come on, enough's enough, all right?
And of course, we got celebrity chef Springfield Bones in the back. He was discharged. He had an honorable discharge from the military, and now he's pursuing his dream.
Culinary pursuit, yes.
All right.
Yeah.
Impressive.
I hear he's
Impressive.
very good with food that he has bone broth. That he can use bone broth with. That's the new thing now, bone broth. Everybody wants to, so
Right.
he's a natural.
He stirs. He stirs it with his arm.
With his arm
or his
whatever.
leg.
Yeah, just pulls
That's
it
right.
up, pops it back on. Jose, I mean, it's great to have you aboard. Thank you for coming aboard. I mean, you and John go way back. You want to tell us how you and John got together?
Absolutely. We've known John for about 2.5 years now.
Wow.
Surprisingly, we met through our medical story with our son, and our son was born. Quick recap: our son was born August.
Don't make it too quick.
August
We got a lot of time to fill.
2020, October 13th to be exact. And
What time? What day?
October 13th,
My
2020. He was born in Hoboken, New Jersey.
His birthday was the 13th.
Yeah, the 13th.
birthday.
Meant to be.
His first birthday was Friday the 13th. How awkward
So
was
was
that?
mine.
His first birthday. So,
Yeah, it was born
What?
Friday the 13th.
wow.
No. What?
My mother cried for 3 days. They told her, you can't have this, you can't have this baby on the 13th. And she was just from Italy, so she didn't even speak the language. She didn't know anything. And of course, the story of my life, I came when I wasn't supposed to, and the rest is history.
All of her relatives must have been in black doing the sign.
Oh, yeah, come on. Some of my aunts still don't talk to me.
I could tell you his first birthday that Friday was scorching hot. It was about 104 degrees last
For
year.
October, wow.
And that was August of Friday, August 13th of last year, 2021. That the weather was brutal, and we had about 40 people come to the birthday.
Wow.
And we started at around 3 o'clock. By 5 o'clock, everybody gave me the excuse they were too hot, so most of them left, which is okay. I understand. At least they showed up, and that's the important part of it. But
As time goes on, you start weeding the relatives out anyway.
yeah, you know how that works.
Yeah, absolutely.
Help me clean
That's
a little
good.
bit.
There you go.
All right.
Right, it works. But we met that year. Interestingly enough, our son was born with Hirschsprung's disease, which Dr. Gallucci, John, was an expert at treating in terms of the procedures required to get past his disease. So we were blessed to have met him through that. In a sense, nobody ever wants to meet at the hospital. You may
Right.
say, but
Hospital's a shitty place to get to know people.
yes, absolutely. I worked there as a security guard, and in that aspect, I worked as a financial advisor at the hospital. Not in this one, but in other hospitals. So I understood kind of like the,
And that's how we'll keep it. name-wise.
Yeah.
This
Yes.
one.
I'm going to put
Yeah.
you on the
Right.
spot now, Jose.
Go ahead.
So tell me what your first impressions are when you met Dr. John.
Oh, geez, no,
I mean,
no pressure.
You know, it was.
No pressure, but be honest, because I actually know what you're going to say probably, but go ahead.
You know, at first, I don't know. It was more like, you know, what do I expect from this person?
Is this
Am-
guy a jerk? Is he on the money? Is he
Yeah.
for
does
real?
does he
Right?
know that I'm gonna come at him like a lightning bolt? I don't think that.
And
you
he
know,
knew a lot about Hirschsprung's.
Yes.
Oh, wow.
So I came ready. It was our third son, it was a third child, our only son, and so I was even more committed to making sure that I got to know who this man who was going to touch my son in ways that you couldn't, you know, only God can grant you the gift to do so. And so when I saw him at first, I was like, oh, this guy looks, you know, SBF, man, SBF, just like you, Nadia. And I told her that, and she goes, no, it's
What's
not like that.
SBF?
Yeah.
Standing bitch face. So I was like, oh, Jesus, what is this guy going to come at me with?
Mark, that is.
And
right?
then when he,
I'm going to remember that, John.
Right.
I think what changed me was the way he approached.
Did you just call Nadia SBF?
No, I
Oh,
was
I
like,
thought
I
you
told
just did.
Nadia, that,
Oh, I thought
Nadia,
you
he has
said-
SBF, and she told me
I
not to
thought you were
worry.
in trouble when
She
you went
doesn't
home,
think
man.
that, you know. Although Nadia doesn't make a lot of friends right away, like on the first go, because they think she has SBF, and I tell them that's just SBF. Don't worry, she's a really nice
You
woman.
masterfully just pulled yourself out of that hole.
Yeah, no, not like that. She knows.
Husband material.
But then when he started speaking to me, we were both in a very like strange situation that we've never experienced in NICU.
Very delicate
We saw many parents there, babies who were going through difficult circumstances, and we were just like, wow, why has God put us into this situation? And we didn't know why, but we wanted to make the best of it and get as much information. And so when he started talking, he immediately, through his words and the way he said things to his patient at the time, which his patient's parents, he was very honest, direct, but understanding that the situation is very grave. So, and I think that was a very important quality of that experience.
I know exactly where you're coming from a little bit because my daughter had to go to the oncology center at Hackensack Medical Center, John. They have a children's oncology center for some tests. And I remember walking in and seeing the face of the parents that were there and their
Oh, Jesus.
children were getting treatment. And I said the same thing you did, like, wow, how did I get here? What's going on? You know,
Yeah.
so it's very grave. John, what was your first...
Everybody's kind of a deer in the headlights.
yeah.
Yep.
What were your thoughts when Jose came with his family?
This is all motherfucker.
Yeah, I give that kind of.
I Hirschsprung's disease is a motherfucker, and you know that, right?
Yeah.
It's nothing like a hernia. Okay, a hernia, kids got a hernia. Some hernias are really difficult, and most of them are really straightforward and pretty easy as long as you know what you're doing. And but so there's an operation, then they go home the same day and they heal and they come back 2 weeks later and everything is good. I'm breaking my own dictum about not getting close enough to the mic.
Yeah.
Sorry, guys. But Hirschsprung's disease is the stepwise procedure where there's clinical suspicion of Hirschsprung's disease. A newborn, 30% of all newborn babies that have Hirschsprung's will have abdominal distension and they'll throw up green. They'll have bilious emesis. So there's some kind of partial obstruction going on, if not a frank, outright, complete obstruction. And then there's x-rays taken and you might see dilated bowel. And then after that, there's this stepwise procedure that, once the pediatricians or the neonatologists are clued in, this kid has got something going on in the GI tract, before anybody does a rectal exam on that baby, as long as there's a rectum and fine. But one of the stories is that when the baby is born, if they don't pass meconium, which is newborn baby poop, if they don't pass that within 24 to 48 hours, now all of a sudden you're really, barking up the tree of Hirschsprung's disease, because that's almost a hallmark of the disease. But when that happens, everybody's cued in, this baby could have Hirschsprung's disease. And then one of the first diagnostic studies you do is a contrast enema. And when the contrast enema is done, that's, it's, most people say, well, it's a barium enema, whatever. if you see that the area of the rectum all the way down by the anus is fairly tight and that the colon above it is distended, that's what's known as reversal of the rectosigmoid index, and that is very strongly suggestive of Hirschsprung's disease.
Okay.
And then at that point, knowing that, nobody would do the full Hirschsprung's operation of pull-through. We'll get that in a second. Nobody would do that without a confirmatory tissue diagnosis of Hirschsprung's disease. So what happens is you'll have to take either the baby to the operating room and do a transanal snip biopsies, just inside the anal verge. And I'm kind of dumbing it down. I'm not going to get too technical, but most centers will have either the surgeons or the gastroenterologist use what's called a suction rectal biopsy gun. And it's a little kind of a smooth, round edge trocar that goes into the anus. It's calibrated so you know how far in you go. You got to push it down so that you're grabbing the mucosa on the bottom, so to speak, or the backside, posterior mucosa. And it's generally done by two people. One person pulls back on a big syringe plunger to create a negative suction at the tip, while the surgeon or the gastroenterologist fires the gun. And when it fires, it'll cut a piece representative of the area that has to be sent to pathology. And it's generally, it's a pathologic diagnosis. I'm not going to get into that. But if your baby's got Hirschsprung's disease, by the final patho, then you're looking at what's called a pull-through, which means the area just above the anal verge. And the anal verge is where the perianal skin, if you go inside, right, the perianal skin changes to the lining or the mucosa of the rectum. It's got goblet cells and it makes mucus and whatnot. So it's not the skin around the outside, it's the inside of the canal. And so from there all the way up through the area, so that you get all the Hirschsprung's bowel, that has to come out, and then you pull the normal bowel down. And in some centers, they do it without a big incision. Other centers not. Most places do it now without an intervening colostomy, which is where you pull out the healthy bowel and they poop into a bag for several months. And some places do it without. And why they're vacuuming in this hallway now drives me crazy. But I hope that we're not.
Now we're gonna be okay.
I hope that we're not.
John, a clean hallway is a happy hallway.
Yes.
Right.
Keep the riffraff out of there.
There's two hair cutting salons out there, so I guess it's better than tracking their hair into here.
Okay.
So
well,
generally, that's the idea with Hirschsprung's disease. So how many times did your son go to the OR, or was he? At least, others attempted biopsies before we had a diagnosis.
I think that it was just two. The first biopsy was the enema, which wasn't conclusive. I think you came up to me. I remember that moment because I was livid. I knew that if that didn't come back, that they would have to actually put him in the OR and do the actual
suction rectal biopsy.
And him had already gone through all these things. I was angry for him, and that was, as a parent, that's what a lot of it was. But I knew I had to be patient because it wasn't just me going through it. It was my wife. It was every other family in that room.
Yeah.
It was, and I think finding the strength was important.
Jose, were you a religious person?
Growing up,
that?
yeah. I mean, I thought I was in a cult when I was growing up. To be honest with you, I love my mom to death. Like my mom is an amazing, beautiful woman, but church was difficult for me.
Yeah.
I would be lying to you.
Did you lean on God when?
Absolutely. I mean, I recently overheard you talking about how, most of us who believe in God, we don't, many of us don't go to church anymore. And yeah, we should go. Some of us should go once in a while. I don't think it's something. I've always said the church is in your heart, and the Bible is what you live every day. So that's how I kind of focus on it. I don't get a chance to really get into the whole, I've been there with my mom, catch the Holy Spirit and maybe, I don't know. I've always told her I never.
So is this going on though? You were leaning.
Absolutely, but I knew that in these moments and the moments that you need to find the strength, you need to lean on him. He is real. I do believe that God is real, and he works mysteriously through people who are good and bad as well. We have no saying in what he does and why he does it. We just have to try to make the best of understanding it and doing it. But in these moments, it was beautiful to finally kind of see the culminating, conclusion of this journey that my son's and who continues to be having. Now he's in the recovery stage, but we continue to have as a family, and putting us together here is just literally a testament to that specific moment in time. And so it's a beautiful experience now that I go back and look at it, because I've learned not just about my son, but I learned about my past, growing up with Hirschsprungs and not knowing. I didn't even know it was Hirschsprungs till I was about 18 years old.
Wow.
So growing up, I was like, what the hell's on my stomach? Where are these incisions? Right. I was afraid to take off my shirt. I was afraid to talk to people about it.
Sure.
I never understood why I'd go to school and I'd had to go to the restroom 5 or 6 times a day, and I'm like, am I normal? Yeah. Like, I don't see kids going as often. And so it was weird, it was really weird. My dieting wasn't good when I was younger because my mom never taught me about Hirschsprungs. And I think that she didn't do it out of malice. I think she did it out of just literally trying to forget about that time.
Is your mom still with us?
Yes, my mom is still with us. She's 67 years old.
What does she think of your son in this whole saga? She must be like amazed.
She's in love with him. Yeah. That's just the most important thing. Right. I truly believe that she's also learning about what she failed to learn then. I mean, because at the time you would think, I'm an Irish twin. I don't know if you guys know the term, right? My brother and I were born in the same year.
Wow.
11 months apart. And so my mom told me a story recently about how I had the colostomy bag out, and then the actual colon was completely out. Like, it was prolapsing. It was, and she's like, I had this newborn in my hand and an 11-month-old in my hand, and this one was crying profusely.
Who was older?
My brother, by 11 months.
Right.
But imagine feeding these two, and unfortunately my dad wasn't around. My dad left prior to me being born, and so my mom literally did it on her own. And like I said, all respect, I don't know what the
big time, huh?
Yeah,
They
I
don't
don't
make them like that anymore.
I absolutely, she's amazing, and I don't have any malice or rancor or any hate towards my dad. He's a great man. He's raised 2 beautiful daughters since that time. There's no malice in my heart for him. I mean,
so he's around.
He's around but not around. Let's just say he hasn't come and seen his grandson, but I've already given him the doors open. He's there.
Good for you, man.
Yeah.
God bless.
Absolutely.
Real quick, I read a book one time, having issues with my father as well, that your parents give you the greatest gift. They bring you into this world. After that, you're on your own. Thank God they brought you, and the rest is you got to figure out.
And I recently texted him, believe it or not, out of the blue, and I told him, I don't dislike you. It's just, I literally just summed it up with, don't make the same mistake you made then with our grandson. He hasn't met our grandson since he was born. I don't know if it's job related. I'm not here to judge.
Yeah.
I mean, but it's very common. It's obvious.
Could be guilt on his part.
It could be, but I've already opened the door. God tells me every day, don't hate anyone. Don't unwelcome people who need to be in your children's life. And I've never done that. Wow. And I will never. If he ever shows up and wants to be part of, that's his choice. He has to live with the choices that he's made.
Well, now you had that as well as your son, but you grew up to have an athletic career.
Oh, absolutely, man. I put it out there. I didn't grow up in a very healthy family. Let's just say. Till today, many of the people in my family battle with illnesses that kind of they could have prevented. And again, doesn't mean I don't love them, doesn't mean I don't care about them, but they've taught me something. They taught me through their actions, through their choices. I've been able to learn. I've always been a visual learner, and I see. I don't make mistakes that I can stop if I've seen them before. Wow. So when growing up, my brothers, ate a lot. They're not healthy people right now. They're working hard to get there, but I didn't want to be that way.
Wow.
And so
so you had them as a yardstick.
pretty
Right,
much.
and you said,
I was the
"Oh."
youngest, but I behaved like the oldest.
Wow.
Wasn't
You
that
were born
interesting?
with an old soul.
A lot of people
That's
say
what-
that.
I think you're right, Phil.
A lot of people say that, and it wasn't easy. You know, it wasn't easy because I wanted to play sports, but I also understood that the necessity in the home with money and having to go to school. My brothers only finished high school, you know, which is not a bad thing. They finished high school. They just didn't have that self, motivation that
You
sometimes
played
you have.
college ball?
Yes, I did. I played I played baseball I started playing baseball at the age of 14, very late in my life. I played at Lincoln High School for 4 years in Jersey City. We weren't that good. It was just a beautiful experience to be with those guys, even though we were at different levels athletically. I soon started getting recruited around my junior year by many colleges, St. John's University, Rutgers,
St.
New
John's is so
Brunswick.
dope.
I had many schools. I'd go to many camps, tryouts and like workouts for colleges. And believe it or not, junior year, I was stuck on the fact that I was going D1. I knew it. I knew I was going D1. Then fall of my senior year in high school, I tweaked my elbow and I stretched the UCL, the ulnar collateral ligament. And
Did you pitch?
Yes, that's all I did,
You were a
literally.
pitcher.
That's all I
How
did.
tall are you?
I'm about 6'1" 3/4. I would say I usually just say 6'2" because it's easier. It's an easier number.
6'2".
But I was also very thin. Growing up with Hirschsprungs, you release everything you eat pretty quickly. It's almost like a lifetime bout of EBS.
What was your ERA in high school?
Oh, it was terrible.
Oh, it was bad. Well, how could it be bad if all these problems?
Because in the end, I always say talent speaks for itself. You can't control a shortstop's second baseman or third baseman's glove.
Good.
Rule number one: don't let the ball go under your legs.
Very well said.
But
Very well.
high school, I moved out. It's funny how life works. Growing up in tough times, you don't make excuses. And when I played on that team, I knew what I was getting into. I knew we weren't that good. I knew I lived in a community that wasn't full of ball players. Did we have some? Absolutely. Did we have potential? Yes, we did. But to sit there and be in a community to think that I was in a community that full-time baseball players, no, absolutely not. It was more a football, basketball community. But that prepared me, my life prepared me for those moments because I knew it wasn't that I was accepting that we were losers. I just would find the moment to improve myself within the worst hard times of our career.
A mature situation.
Absolutely.
God bless you.
I always tell my teams, and I coached, I remember coaching West Side High School baseball as an assistant coach with Mike Dixon, who's an amazing coach and still educator in Newark. I remember being in this school and they told us, I want you to create a program. And Mike Dixon had stepped down and I took over. And it was like, how do I get kids to compete at the high school level when they have never learned to catch? So I was competing with that. You have to have some foundational skills. And so in that case, I also, reverted back to what can I teach these kids on this field, whether they're going to play baseball later or not.
Yeah,
what can I do?
Jose and John, I know that your kids were involved with sports as well. Because I coached on a lower level for at least 10 years and loved every second of it. It's not just about sports when you're coaching kids, right? It's how to prepare, how to get along with teammates, how to compete. Yeah, listen, we all want to win.
How to deal with overbearing parents.
How to deal,
Well, I wish I had those sometimes, but we didn't, we didn't in those
Was
areas.
that an inner city school?
Yeah, West Side High School is literally on South Orange Ave,
Yeah.
right by UMDMJ. I lived near the area for 3 years. I lived on
Just by Bergen Street.
Yep, just by literally, I lived around the corner from UMDMJ. But after high school, literally my record, I believe, pitching wise in high school, I'm scared to tell you.
Okay.
I was about 5-19.
So where did you go to college to play?
I was recruited by numerous colleges, but in the end, I chose to attend William Patterson University. And one of the reasons was because
Great baseball program.
Jeff Albies sent out some really good guys to recruit me, local guys, Hudson County guys. I've always thought that you need to send out recruits who understand the people that live in that community.
Sure.
And they didn't serve me with bullshit and like, oh, you're gonna play first day, you're gonna do this. No, they told me what it was, what it could be, and only I could get there. And so I chose that. They were I felt they were the most honest group of guys and the most honest coach that I
How
could
many
play
years
for.
did you play in college?
I actually, I'll tell you a true story. I played in college at William Patterson for 3 years.
Nice.
I could have played my fourth year. Unfortunately, there was an incident in the fall where Jeff Falvey's, and I talk like this because he's still a very important person in my career, in my life, and I thank him for a lot of things. But he cut me November of 2002. November 2002,
Wow.
he cut me. And he cut me because he needed room for a D1 player that was transferring in, blah, blah, blah. And interesting story. It wasn't until about 2 weeks ago where I text him out of the blue because sometimes I get these urges. We had a big blowout on Facebook, and before I removed my Facebook, but I felt the need to apologize for how I expressed my honesty. And I noticed I didn't dismiss what I had to say to him, but I wanted to apologize because he deserves that much. I have a belief that whether it doesn't matter how much education you have in life or how much experience you have in life, you respect life experience in general. So if I met a 90-year-old who never went to school, you know what? I'm still going to listen to some of his stories. You know why? Because that's 90 years of life. And so this is how I approach a lot of my elders and a lot of the people that I look up to is, what can I learn from you? What can I grab from you?
Well, a lesson learned there is you can't really control what life throws at you.
No.
So it's how you react to it. Because life's going to hit us all, right or wrong.
No.
Yeah.
Everybody, we're all going to get our turn in the barrel.
Yeah.
And when it's your turn, are you going to let it eat at you, destroy
Absolutely.
you, stress you, or are you
Yeah.
going to control it, move on,
Yeah.
and become a better person?
So
for
was
it?
William Patterson D3?
It was a
D1A,
D3. It was a D3 school, tier 2 at the time. I believe it's tier 1 now because of the funding. It's tier 1. Our rivals were Montclair.
Right, of
We
course.
played Montclair to the fullest at that time. We had some really good experiences those 3 years. For my freshman year, I think I had an ERA of like 1.95, but I only pitched like 15 innings. One of my best experience was pitching at West Point my freshman year.
Oh, I
It was
love West
beautiful. I
Point.
fell in love, and I think it was the first time in my life that I felt somewhat some type of patriotic, connection to this country because of how beautiful and how consistent the individuals within that institution were when it came down to like a game or preparation for an event. I mean, I remember pitching. I was on the mound going into my second inning, and I'm throwing the third pitch to the first batter. I remember this, and all of a sudden the Star Spangled Banner went up.
Oh, wow.
And everybody in the facility stopped, dropped everything, began to
right
salute.
there.
And I'm here lost. I'm
12
like,
o'clock in the afternoon or something?
yes. And I was like,
Right.
what just happened?
Right.
Even the umpire, even the players on the other team, because we were playing Army is Division I, but we were scrimmaging them. So that's why it was so important for us. We gave them a beat down.
Oh, I
Okay,
love it.
we gave them beat down. We little old D3 went up there, but but you remember if you mentioned Dan Pasqua, those teams, the '90s William Patterson team, those were College World
Dan
Series
Pascal
baseball
went to the
teams.
majors.
Yeah,
Very successful.
we have a big strong community of coaches from that era and players from that era who still compete, who still coach. It was a beautiful experience at William Patterson. I mean, getting cut was hard at the time, but going back to Jeff Albies, I had told him last week that, it was hard to get cut because what you didn't know was that I was working an 8-hour shift. I was feeding myself and going to classes, 6 classes a week, and playing baseball. And my mom wasn't helping me because she couldn't. So here I am devastated that I've sacrificed all these hours.
What a great story.
And you know what? Now I go back and I think of it, I go, it's okay.
Yeah.
I learned a lot. And he actually apologized in that text, and he wishes that he could have understood at the time. I said, it's okay.
Yeah.
Because that's what brought us here, And as long as you understand, I have no quarrel. And we had a political quarrel. But I always tell people that it doesn't matter what you believe. To me, I could sit next to a Democrat, a hard left guy, and still deal with them. Why?
Absolutely.
Because God has given me that patience. He's given me that ability to put up with stuff that it goes in out the literally in out the other. I like who you are. I don't care what you believe in, because in the end, that's a personal thing.
Sure.
But I like who you are, and I want to sit next to the person you are. You know what I mean?
There's a reason in the voting booth that there's a curtain, right? So nobody sees who you vote for, nobody knows where you pull the lever for,
Right.
because it's a private thing.
Yeah.
It's a person. For some reason, everybody wants to put it out there now.
Yeah.
And then when somebody disagrees, oh, it's on. Let's argue about it. I mean, for what? For why? You know what? We've lost friends. I mean, we've lost
Well,
family
yeah,
members
that's
over the
right.
political discussion.
That's another rabbit hole. We could go down.
We listen. The last few years have been difficult, and I think that it's interesting how the story of my baseball career became the culmination and the end to that type of relationship that I had with these individuals. And don't get me wrong, it wasn't that these people were bad. I think that a lot of it was they were misinformed in their own judgments, and I like to say it because all it takes is some thought. When I sat down in the hospital many times with you, John, there were things I just didn't understand, but I had to spend time with myself and think. Let me think of what these words mean, what these experiences mean, and what are these events in my life or in the lives of us mean to us,
And your child.
And so I think if people spent more time in thoughts, and spent more time with themselves, there'd be so much to learn.
Absolutely. But you know what? I think your experiences in life made you who you are today. Some people don't go through experiences that humble them, make you stop and think.
Yeah.
So when something small happens, like, oh, I got a flat tire, oh, it's the end of the world, or I disagree with somebody politically, oh, I can't speak to them anymore. People with the paved road, I like to say. But your road obviously wasn't paved from day one. That's what gave you the character that you possess. I'm so honored to be on this podcast with you.
I appreciate
and
it.
John,
And I know it's an honor to be here.
It's amazing. Your story is just amazing. So, John, after Jose's child went to surgery, where did things go from there? I mean, he pulled through okay?
He pulled through okay. It's not a one-shot deal like a hernia repair or, God forbid, a tumor removal. Those are generally one-shot deals. Hirschsprung's is a stepwise fashion, and there are reasons for that. Some places do it all in one step, and other places don't. And it had a lot to do with I don't mean pathologic services. I mean the services from the Department of Pathology. That's a different road. And anyway, so after all of the surgery was finished, which I believe was two or three.
June 5th was the pull through.
Yeah, right. June.
Jose
I remember those
it was
dates
yesterday.
because
He's
they
got
were
dates and
haunting.
times in his head from back in the.
They were tough but beautiful days.
baseball.
Yeah.
You know it.
Even what pitch?
I can't remember how I got
I don't know how long that's gonna last, but
Yeah, God bless.
one of those buttons will probably shut down one day.
So kids with Hirschsprung's disease, after the perfect operation, and I would like to think that he got the perfect operation from myself and my associate at the time. There's all different shades of gray with Hirschsprung's, and it depends on how much native colon is left inside, right? So 85% of the kids with Hirschsprung's disease, I got to sit next to this mic, 85% of the kids with Hirschsprung's have a transition zone where the congenitally abnormal bowel meets the good healthy bowel. 85% have that transition zone all the way downstream in the rectosigmoid, or the all the way down toward the pelvis, let's say, okay, to simplify it. Which means that after you take that bad intervening segment out and you reconnect things, they've got most of their colon left. And the job of the colon is not to digest food. It's simply to absorb water and electrolytes like sodium, potassium, and whatnot. So for the kids that are left with no colon, now you've got a situation where they have no colon, they've got their small bowel, and there's different ways of dealing with that. But that's tough because what they eat generally shoots down through their small bowel, and the small bowel's job is to absorb, proteins and fats and whatnot, lipids, and not necessarily act like the colon. So the more colon you have, the easier generally it's going to be. And some kids have not much colon left. And so our patient here had kind of a rocky road because 50 to 60% of the kids who've had the perfect operation still have dysfunctional bowel habits, and you probably
We're dealing with
understand
some
that,
there,
but
but
you understand that better than anybody because you kind of went through it.
yeah, and even till today, I mean, it wasn't until our son was born where I really started taking my diet really seriously. Because growing up, I didn't understand how it was difficult. I would tell my mom, they need to serve water in school. She goes, why? Well, you're not drinking the milk. I said, Mom, every time I drink the milk, I'm running 6 or 7 times to the bathroom.
Yeah, that's a problem.
And I like milk. Don't get me wrong. I like my bowl of cereal, but I can't drink it because the milk doesn't do well. Now people, well, he's lactose intolerant. Well, it's a little bit different this time, you see, because not only am I lactose intolerant, I also suffer from the irritable bowel syndrome, which has been all my life. So what I've learned to do is control when I eat, what I eat, and make sure I remember what types of food cause my body to respond the way it does.
Upheaval,
So I've
right.
cut like pernil pork. You guys love pernil. I'm sure you've had it. When they roast a pig and they I love that, but I can't eat it. I could have one little bite and it's over.
You're ahead of the game because as you get older, like these two old timers over here, I don't eat a quarter of what I used to. The pastas.
Me too, and I'm still dealing with trying to get rid of my gut.
Yeah.
You had an incident at the time during that almost around the time frame between the surgery and his pull through.
Oh yeah, right, and that's right. That's right. He was right in the middle of it, wasn't
Yeah,
he?
right in the middle.
Yeah,
No kidding.
yeah. I had to have part of my colon removed.
I think it was
Yay.
between January and April of 2021, if I'm correct.
Well, I
Right?
got my 5th attack of diverticulitis. Now we are old men.
Hey, I remember my 5th attack.
Right. So and so
It was a
yeah,
Tuesday.
and I ended up having a robotic and open hand assisted, if you will, extended sigmoid colectomy by friends of mine, and I like to say they saved my ass.
Literally.
And and they're really good at reminding me about how they saved my ass. Thank you, fellas.
Friends are for.
They don't mind telling you you're full of shit.
So
if
I
you
had
need
like
to.
my surgery was difficult because I had a lot of scarring and adhesions on the inside, and so it lasted close to 6 hours. And these guys were really, really good surgeons. So I gave really good surgeons a run for their money, and then as a matter of fact, I got COVID Christmas Eve of 2020.
On top of that.
Right. And just as I was coming out of that, because I got the long haul COVID, I was ready to come back to work. Boom. 5th attack of diverticulitis, and off to the OR I go. And that
Back
was
to back.
that was a son of a bitch. Yeah, that was a real son of a bitch. And I think during that time that I was out, your son was waiting for his reconstruction, wasn't he?
I was getting upset with you.
Well, yeah.
I was like, "Where is this guy?" And then they had the other. I don't want to put his name out there, but they had another one. And I said, no, I want Galuch.
Yeah.
I want the G-man.
That connection.
Yeah, and I think that's what it was. I really and everybody in that, many of the people that worked there did a wonderful job. The nurses, the staff members, John. But I wanted him, and I knew I was like, you know what?
And you should have.
He already opened. He already did what he had to do. I want to see him do. He put the colostomy bag. He touched my son in a very intimate and and dangerous way, and did a good job. And I said, you know what? I don't want nobody else touching. If he goes somewhere, I'm going there wherever he goes.
Right.
And that was my mentality.
So everything that needed to be done was done, and it's funny that. The pandemic, the plandemic, caused delay in 3 kids with Hirschsprung's disease. It caused delay because the hospital deemed the pull-through as, non-emergent surgery, which it's certainly non-emergent surgery, right? But each of the 3 kids had a form of Hirschsprung's that this taught me a great indelible lesson that if you got a high transition zone where your transition zone's all the way up by the splenic flexure and the transverse colon, it's all the way around to the hepatic flexure. which means most of your colon's coming
coming
out
out,
with
yeah.
the final reconstruction. The last thing you want to face in the OR when you have a baby completely opened up on that table is that you can't reach the anus because the transition zone is so high. It's so far away. Now, the colon will always reach, but sometimes you get worried about the blood supply. And that's really where the rubber meets the road, is the blood supply. If you have to start taking and cutting major blood vessels that supply the end of the colon just to get it to reach, now you've cut some of your blood supply, and is the end of the colon that I'm pulling down, is it going to die? Did you just screw the pooch by taking its blood supply?
Yeah.
And that always got me a little bit worked up. But in each of the 3 kids, COVID was the delaying factor. And what happened was everything on the inside, the length of the bowel, the blood vessels, everything grew and elongated. And when it came time for the pull-throughs, it was just, everything just went right down. And quite frankly, I was amazed and so thankful, so thankful. So it all worked out great surgically.
It did.
And he got what he needed. But like I said, more than 50% of the kids with Hirschsprung's disease still have constitutional issues,
Yeah.
even after the perfect pull-through. And that's something that most of the kids will grow out of. But then beyond that, actually, you're the expert, right? So we already talked about that. You're the expert on how Hirschsprung's will affect somebody through the rest of their adulthood.
Yeah.
You get the big bucks, though.
That's what sounds like. I mean, this has been a fantastic episode.
Yeah.
It should
Thank
be
you,
an
guys.
easy one to alchemize, if you will.
Well, yeah, I mean, there is no real dark issue here other than the fact that we live in a 3-dimensional existential world where we are constantly dealing with what I would call spiritual attack, strife, disease, whether it's a congenital anomaly or a genetic thing. And I would like to say that the way this plays to me spiritually, because this is how we roll on The
Yeah.
Alchemist, we try to alchemize it by pulling it around and saying something in a very positive light spiritually. You get a little guy who was born into this 3rd dimension with something like Hirschsprung's disease. Wow. And it's very touching to me that he was born unto you and your wife, his mom. And I think, you were the predecessor. You're the guardian here for your son in such a big spiritual way, because you remind me of John the Baptist. You paved the way. You made a straight path for Jesus, right? Because he was there kind of mowing down the trees and making that runway, making that straight path. You suffered with Hirschsprung's disease, and your testimony was that your dad wasn't around to aid the situation.
Yeah.
Not so for your son. So on the dark side,
Absolutely.
you had Hirschsprung's, and so does your son. But on the bright side and on the spiritually fulfilling and enlightening side, you paved the path, and your son couldn't be in better hands with his mom, who she is, because I got to know her, and who you are as his dad. He's blessed. He's very fortunate, and I would say God bless you and Nadia, the whole family, and the other kids too, everybody.
Thank you, and he has blessed us, and know that. And I guess I leave this conversation with the fact that you can find lessons and you can find light even in the darkest places.
There you go.
But you have to open your mind and open your heart to yourself and to God, and most importantly, first to yourself, because if you just remain hazy-eyed and hazy mind, you'll miss out. You'll miss out on the opportunities you have to gain and to learn. I was always taught that individuals who miss out on opportunities don't miss out because they're not ready. they miss out because they don't have the eyes and the intellectual ability to recognize when that opportunity is in their face. And so I've been blessed to have taken advantage of opportunities when I've seen them. People have thought of me as crazy, as
Oh, you are crazy.
for doing it, but
Well, we
I'm
have
here
in common.
today, so
Yeah.
that works.
Beautiful. What a
Amen,
great
brother.
job.
Thank you,
Amen.
gentlemen.
What an impressive.
You guys are amazing.
No, we're just
Keep
got-
up
what
the
an
great
impressive
work.
young man.
Thank
for
you. I
that.
look forward to being back.
Thank you for watching us on the Jersey Alchemist. If you like what we're doing, press like, follow, and
Subscribe.
and
Definitely.
share. And share.
And
Tell
share.
your friends.
Listen,
Absolutely.
sharing is big, and I'm going to tell you why. Because just like the 2020 election, we were growing in leaps and bounds with our viewership, and then all of a sudden, by about the end of the evening last Thursday, all of a sudden, boing, everything dropped off. How does that happen? How does it just drop off when our viewership was going up, up, up? I call it shenanigans. I'm looking at the monitor. I should be looking at the camera.
A lot of shenanigans.
Shenanigans going on here. So if you share the Jersey Alchemist, if you like what we're doing here, people, for God's sakes, you know what? We have to combat shadow banning and censorship. If you share this, it's hard for them to stop it. Amen. See you next time on the Jersey Alchemist.
Free the Jersey Alchemist. Let's chant. Free the Jersey Alchemist.
That's it.